Hi guys, I am METOCLOPRAMIDE and my brand names are Reglan and Metazolve ODT and my chemical name is. So I have two drug classification. For the therapeutic classification is that I am an antiemetic and a GI stimulant. And for my pharmacologic is that I am a para-aminobenzoic acid derivative and a dopamine antagonist. So my pregnancy category is I am a pregnancy risk category B. So my mechanism of action is that I blocks dopamine receptor at high dose and serotonin receptors in chemoreceptor trigger zone of CNS and sensitive tissue to acetylcholine, increases upper GI motility but not secretions, increases low esophageal sphincter tone. My pharmacokinetics for absorption is that after oral administration, drug is absorbed rapidly and thoroughly from the GI tract after IM or intramuscular administration. About 74% to 96% of drug is bioavailable. And for distribution is that I am distributed to most body tissues and fluids, including the brain. Drug crosses the placental barrier and is distributed in breast milk. For metabolism is that not metabolized extensively, a small amount is metabolized in the liver via conjugation. And for excretion is that I am mostly excreted in urine and feces. Hemodialysis and renal dialysis remove minimal amounts. My indications for drug-to-drug is that acetaminophen, aspirin, diazepam, levodopa, lithium tetracycline increases absorption of these drugs. Monitor patient carefully. Anticholinergics, opiates may antagonize effect of metoclopramide of GI motility. Avoid use together if possible. Antihypertensives, CNS depressants such as sedatives and tricyclic antidepressants may lead to increased CNS depression. Monitor patient carefully. So for my contraindications is that I am contraindicated in patients for whom stimulation of GI motility might be dangerous, such as those with hemorrhage, mechanical obstruction, or perforation. In patients hypersensitive to drug and in those with pheochromocytoma or seizure disorders. Use cautiously in patients with history of depression, Parkinson's disease, or hypertension. My side and adverse effects for CNS is that I cause restlessness, anxiety, drowsiness, fatigue, lassitude, depression, insomnia, confusion, suicidal ideation, seizures, hallucinations, headache, dizziness, fever, dystonic reactions, and extrapyramidal symptoms. For GI is that nausea, bowel disturbance, and diarrhea. For GU is that urinary frequency, incontinence, and prolactin secretion. For the respiratory is that I cause bronchospasm. For skin is that I cause rashes and urticaria. And for others that I cause porphyria and loss of libido. So for nursing responsibilities, before the nurse should conduct assessment, history taking, and physical examinations. Evaluate the cautions and contraindications in order to avoid any unfair complications. And during the administration is that the nurse must educate the client, determine the correct drug, provide patient education, warn patient to avoid driving for 2 hours after each dose because drug may cause drowsiness, and until extent of CNS effect is known, advise patient not to consume alcohol. And after administration, the nurse must monitor for adverse effects and monitor the well-being of the patient. That's all